When you first get diagnosed, it's really, really stressful. So you are sick, you may have had surgery, there's so many new things, you're establishing care with a doctor, there's so many unknowns, and so that first being diagnosed, sometimes patients get into my door and we have some time to just process all of the changes that are going on in their life. And that's fine. That can be a really adaptive and therapeutic time for patients. But then there's also this period kind of a year later where you're out from surgery, you're doing pretty well, or you may be doing well, and you kind of have this sit back moment where you recognize, oh wow, I have a chronic disease. This is not going away. Now what? And that's when I really like to work with patients to discuss different management strategies from both a Crohn's and colitis perspective, a stress management perspective, different coping strategies to recognize when mood may be shifting. And so that can also be a really important time. And then both women talked about sometimes it just not feeling like the right fit with a therapist. And so I have some tips in terms of locating a provider. And you really want to find somebody that has expertise in the management of anxiety, because we know that stress doesn't help anything. And it's a bonus if you can find somebody that specializes in gastroenterology or chronic health issues. So you really want to find people that are a good fit for what you're looking for. And some of the treatment modalities that they offer should include cognitive behavioral therapy, as it's evidence-based for this patient population. And then there's also this stigma that can go along with seeking out mental health care. So I like to destigmatize that by highlighting that a lot of the people that I work with are very high functioning folks. And they may never work with a psychologist if they didn't have a chronic disease. And so they're really looking for tools and strategies to just help improve their management, their quality of life, overall, how they feel about how they manage stress. And so really highlighting that you don't have to be psychiatrically ill to seek out mental health care. It really can be when you're doing pretty well and you're just looking to strengthen your skills, highlight your resiliency, and set yourself up to manage different complexities that are going to happen in your future.